Pursuant to the rule, the gentleman from Texas is recognized for 5 minutes in support of his motion.
Thank you, Mr. Speaker. I offer this motion to recommit because Republicans have been motionless when it comes to acting on the spiraling drug prices that are harming so many Americans. The willingness of this Congress to sit on its hands, stand idle, in the face of the prescription price gouging that so many of our neighbors face is nothing short of appalling. And there's nothing smarter in this bill about dealing with that terrible problem. Of course, President Trump has told us it's going to be beautiful. But every time you turn around, he's cozying up with some pharmaceutical lobbyists that are raising prices and putting some of their people in charge of his drug agenda. All that this motion does is to take the very modest step of reducing the possibility that through further mergers of drug companies, we will see the sick and dying extorted even more than they are today, with skyrocketing prices that are made even worse when these mergers occur. If this motion passes, it won't kill the bill or slow it down a moment. What it will do is to give life to an effort to contain these mergers and see that prescription prices don't soar even further. Yes, it's not the principal issue on drug prices. Unfortunately, there is no wonder drug to stop prescription price gouging. But this is one of the only ways to get the issue to the floor of this House, because our Republican colleagues in every committee are determined to remain silent and see no action whatsoever. You know, I continue to hear from my neighbors back in Texas who care about this a lot more than my Republican colleagues. They tell me they cannot afford their prescriptions, or they are burdened with immense debt to do it. I think of Elaine in San Antonio, who has suffered with glaucoma for a number of years. She's fighting to save her eyesight, but now her copays on 3 different necessary drops are costing $400, $227, $178 per month. And she says she wants to finish her senior years in dignity, but is burdened down by these outrageous prices. The choice should not be blindness or writ for a senior who's worked and saved all their lifetime. Even in the face of the opioid epidemic, where we're about to hear a whole lot of bills out here on the floor that don't do a whole lot, but in the face of that crisis, a devastating national public health emergency, the price of naloxone, a life-saving overdose reversal drug, has been spiked by almost 600%. You know, even an effective drug is 100% ineffective when it is unaffordable. Too many drugs are ineffective for too many people because drug prices have soared at a rate of 10 times the rate of inflation. But where some see a crisis like that, others see a revenue opportunity. Brand name pharmaceutical manufacturers rely upon government-approved monopolies to charge monopoly prices whatever they can get out of the sick and dying. They utilize as many maneuvers as possible to perpetuate their monopolies as long as possible, while pouring their money not into research and development of new drugs, but into lobbying this Congress and the administration. Drug manufacturers spent $171 million last year in federal lobbying, more than insurance, oil and gas, electronics, or any other industries. They had more lobbyists than we have members of Congress. In fact, they could have a 2-on-1 defense to assure that this Congress is quiet, it is inactive, it is unresponsive to people. Let's pass this motion and ensure that when the pharmaceutical companies use the $80 billion tax windfall that they were just rewarded by the Republicans to pay for more mergers, that consumers don't again get caught in the middle and see their prices spike even further. We need to commit ourselves to action by approving this motion to recommit, to commit ourselves to putting consumers first over big pharma, and I yield back.